Hi, everyone. We're just going to give our attendees a few minutes to join in. While you're entering the webinar, feel free to introduce yourself in the chat, say where you're from. We're really excited to have you today, and we're going to start in just a minute. So thank you for being here. Okay, we're going to go ahead and get started. If you're just joining us, feel free to pop your name in the chat and where you're tuning in from. This is being recorded, so you will have the opportunity to watch it after as well. I am Megan McCann. I'm the Director of Community Education at Young Survival Coalition, and we're excited to welcome you to a special webinar on financial planning with Monica Bryant from Triage Cancer, who many of you know. And whether you're interested in learning more about managing your debt, student loans, or simply building a foundation of financial health, Monica is here with all the tips and the tools and the resources to help you navigate your finances after your cancer diagnosis. And as always, this and our other recordings can be found on YSC's YouTube channel. For those of you who don't know Monica, she is a cancer rights attorney, speaker, and author. She's the co-founder and chief operating officer of Triage Cancer, which is a national nonprofit organization that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. Just a few housekeeping items before I throw it over to Monica. As I said, use the chat to say hello, where you're from, any insights in your own experience. If you do have specific questions, excuse me, we ask that you use the Q&A box specifically so that we can feed those to Monica and get all your questions answered after her great content. And with that, let's get started.
Thank you so much, Megan, and thank you all for joining today to talk a little bit about sort of financial planning and how to get our ducks in a row, so to speak. So as Megan mentioned, I am co-founder and chief operating officer for Triage Cancer, and we provide education on those legal and practical issues that arise after a cancer diagnosis. A lot of times when I tell people that I'm a cancer rights attorney, the response back is, what's that? Or what's legal about cancer? And the answer is, well, actually almost everything. So from what drugs you have access to what your insurance has to cover, to your finances and planning ahead is actually all based in the law. And so we provide education in a number of ways. And I just want to talk about a couple of these really quickly so that you know after today, in addition to YSC, Triage Cancer could be a source of support for you as you move forward. So we have educational events that are all free to attend, and then we have a number of resources and materials that are all for free and available on our website at triagecancer.org. I'll be pointing to some of those specific ones throughout today, so please do feel free to take a look at the website and see what is available. Now, when we talk about a cancer diagnosis, the term financial toxicity has almost become synonymous with a cancer diagnosis. And financial toxicity is a buzz term that really describes the burden that a serious medical diagnosis like cancer causes to somebody's finances. And we've been talking about it for years in all the different settings, and yet I'm not sure we're that much closer to helping people avoid financial toxicity. And one of the reasons for that is that there are a lot of contributing factors to that financial burden. At Triage Cancer, we think the most significant contributing factor to financial toxicity is somebody's health insurance status. And certainly that could mean not having health insurance at all, but more often what it means is not having the right health insurance policy or not effectively utilizing that policy. And it's no surprise that people may not know how to pick a health insurance policy or use that policy because whoever is taught how to choose between health insurance. And so at Triage Cancer, we always say there should be a class in high school required for graduation where we learn about how to utilize health insurance and our finances, because it's all things that we have to do when we become an adult, but are very rarely ever taught how to do those things. So the very first step in financial planning has to be making sure that we have adequate health insurance, we understand that health insurance, and we're utilizing that health insurance to the full potential. Now, I don't have time to get into all of that today, but we do have a number of resources available at Triage Cancer to help you walk through these different choices. So we have an animated video that's, I think, only 5 minutes long. We have a worksheet that you can print out and actually help you do the math. We have all sorts of tools. So if you are in a position where maybe you think your health insurance isn't adequate or you don't feel confident in utilizing your health insurance, please take a look at our health insurance resource hub and all the different resources there. But even if you have the best health insurance policy that exists, there are still going to be bills. There are still going to be out-of-pocket expenses that you have to pay for. So how do we cope with those bills? Well, certainly once the bill arrives, we have to do our due diligence and make sure the bills are correct. Upwards of 80% of medical bills have mistakes, have errors. And generally, those errors are going to cost us money. Most of us don't have extra money to be just sending over to our providers. So looking at our explanation of benefits, making sure we understand everything that is on there, making sure that we actually received all the services that are on there. And this is an area where we have to engage in self-advocacy. We have to be willing to call the provider and ask, what is this code? What is this service here that's listed? I need to understand what this scan is so that I can make sure that I'm being billed for it correctly. There are some professional claims review organizations. Typically, the way they work is they'll look at all of your medical bills, and if they find mistakes and are able to recoup some money for you, they take a percentage of that. Every organization is a little bit different, but that's generally how it works. The other piece, critical piece around dealing with medical bills is making sure that we don't take no for an answer. So if you receive a claim denial, you have to go through the appeals process. Now, those claim denials could happen after you've received services. So maybe you've gone in for an ultrasound and then the insurance comes back and says, we're not covering that. But a lot of times, especially with young adults, where we see people receiving denials is in the pre-authorization stage, even before they've gotten the service. So doctor says, we want you to have an ultrasound. Insurance comes back and says, we're not covering that. You can appeal at that stage as well. Now, the details will depend on the type of insurance you have, but generally speaking, you're going to have at least 2 levels of appeal. The first is your internal appeal, where you go back to the insurance company and ask them to reconsider their decision. You're going to essentially provide them with more information, more details about why you need that service. Now, if the insurance company still denies the claim at the internal appeal stage, we have the right to file what's called an external appeal. And the external appeal is where you go to an independent entity and give them all of the evidence, and then they make a decision that's binding on both the insurance company and you. Depending on whether or not you've gotten the service is going to determine how long the insurance company has to give you an answer. When the need for that service is urgent, you can file what's called an expedited appeal and get an answer within 72 hours. So sometimes we hear from people that they didn't bother to appeal something because they didn't feel like they had time to wait, but they didn't know about the external or expedited appeal rather. So just keep that in mind. Now, the appeals thing is a little bit tricky because at Triage Cancer, we stand on a soapbox and we shout from the rooftops that you have to appeal denials. But we also recognize that we are just adding one more thing to an already full plate when you are in the midst of a cancer diagnosis. So I fully recognize that it is a lot to ask of patients to avail themselves of the appeals process. But we also know that somewhere between 40 and 60% of all appeals are decided in favor of the patient. So conservatively, half the time when an insurance company says, no, we're not covering that, they're getting it wrong. So if we aren't appealing those denials and we're footing the bill for what the insurance company should be paying, that's going to impact our overall financial health. Now, there are lots of hurdles when it comes to the appeals process. Two that I want to mention today are the organizational piece. The appeals process is likely going to take lots of communication between yourself and your provider. Maybe it's multiple providers, the insurance company. You might end up talking to different people at the insurance company. You might have to go to the external appeals organization. It's a lot of conversations, and it's a lot to keep track of. So I generally don't think the Post-it note method of taking notes is a great one, because inevitably you lose the really important one. So how can you keep track of it all? It doesn't matter. 3-ring binder, spiral notebook, cute day planner, it does not matter. At Triage Cancer, we've developed a appeals tracking form that you can download and print off. The major advantage to this tracking form, in my opinion, is that those blank boxes help prompt you to ask for the information. So you're on a call, you could be really frustrated, 15th call you've made that day, you want to be spending your time in different ways. You might forget to ask, when should I expect to hear back? Or what is the due date for me to send that in? Or what's your name even? So this appeals tracking form can sort of help you to remember to ask those different questions. I also think that this might be a great time to engage friends and family. So oftentimes we hear from people who have friends and family that say, let me know if there's anything I can do to help you. You know what you can do to help me? You can sit on the phone with me when I talk to the insurance company and just take notes so that I can focus on just having the conversation. And that can be something whether the person's sitting next to you or you conference call them in from across the country. So first major hurdle is staying organized. The second major hurdle, in no particular order here, is around knowledge. So most people don't realize that they have the right to appeal denials from their health insurance company, because we know that just in the marketplace, the internal appeals of the 48 million claims denied in 1 year, less than 0.1% was ever appealed. That means 99.9% of the denied claims were never appealed. So when you couple that with now knowing that about half the time the insurance companies get it wrong, but 99% of people aren't appealing, this is a major piece of the financial health puzzle. And it is such a big deal to us that we have a number of resources to help people understand the appeals process, all of which can be found on our health insurance resource hub. Now, when you're going through all of this, it is important to keep records of a number of different things. So certainly any bills, any prior authorizations, any information for the appeals process, but also any non-reimbursed medical expenses. So what are those things? They could be things like, do you have to pay for parking every time you go and get an infusion? Or do you have to take an Uber because you can't drive? Those aren't things that are generally reimbursed by a health insurance policy. And depending on the amount of those unreimbursed medical expenses, they may actually be tax deductible. Again, all of this is hard to keep track of, particularly when we are talking about medical bills that you could be getting from a number of providers. So a tool that might be useful is our medical bills tracker. We're not great with naming things. This is a downloadable spreadsheet. You can download it to Excel or Google Sheets. And what's really unique about this spreadsheet is that it does some of the work for you. So up top, you would put in information about your health insurance policy. So you'd put in information about the deductible and the out-of-pocket maximum. Then as you received bills, you can start to put in information down below. As you add in information down below, it will start to deduct how much you have left to meet your deductible and how much left you have to meet your out-of-pocket maximum. So this is a way where you can keep track of how much more you have to pay out of pocket for the year, which is going to be really helpful when we get to the piece around budgeting in just a minute. This spreadsheet also has sections for you to keep track of how you paid that bill. So did you use a credit card or pay through your bank account or write a check? Do you need to appeal it? And if you have a flexible spending account or healthcare savings account, do you need to submit that bill to them? I tend to be the kind of person that kind of waits till I have a stack of receipts and then I sit and submit them all for an hour. And this is a way that I keep track of what still needs to be submitted. Now, of course, we're here to talk generally about financial planning. And so you may be sort of at the point where maybe medical bills isn't the number one thing on your mind. And it's really about trying to figure out where to go from here with respect to financial health. I often find when I'm talking to individuals in the cancer community, it's challenging because they may have been on a path in terms of their financial planning prior to the diagnosis. And of course, once there's a diagnosis, a lot can change. And so recognizing that you have to start from where you are now, not where you thought you would be or not where you want to be, but where are you right now? And doing so with as little judgment as possible. So how do we actually do that? Well, we've got to do some information gathering. There's some crazy statistic about the number of Americans who don't know how much total debt they have. They might know, oh, I've got this much in student loans or this much in credit card, but they've never actually sat down and thought about how much cumulative debt they have. So that's important in order to be able to move forward. This is a financial big picture document. Again, it's a spreadsheet you can download. And this spreadsheet has two main sections. The first section is where you can list all of your assets. That's going to be anything you own that has a cash value to it. If you own a home, if you own a car, if you have a wedding ring or a checking account or a savings account or a retirement account, anything that you own that has value to it goes in this green column. Then in the red column, you're going to put any liabilities, and this is debt. So student loans, credit card debt, medical debt, car loans, mortgages, anything where you owe money goes in the red section. And then the spreadsheet will actually calculate your net worth, which the first time you do it can be a little bit upsetting. Certainly it was for me. But again, we're trying to take some judgment out here and just information gather. The spreadsheet also has some opportunities or places for you to include things like an account number or login information, any notes. Is there a person that you talk to at that particular bank every time you call about your mortgage? When you put all of that information into one place, again, it's just a useful organizational tool. It can be useful for estate planning reasons in the future. But certainly if you added in that level of information, you'd want to make sure that it was kept in a really safe, secure place. Once we've thought about our assets and our liabilities, we need to also think about, well, what does our insurance portfolio look like, if at all? Insurance portfolio is really just a discussion around what types of insurance might you have access to. There are going to be a number of sources of insurance. So maybe it's something that you've gone out and purchased yourself, like you've gone out and purchased a life insurance policy, or you've gone out and purchased health insurance. Many times you have access to benefits as an employee. I cannot tell you the number of people we have talked to about disability insurance, and they say, oh, I don't have that. And we say, well, just go check at work. And they come back and they say, oh, turns out that is an employee benefit. I didn't know that my provider or my employer provided to me. So thinking about all the potential sources of insurance, and then what insurance you do have access to already, and what might be useful in the future. Of course, this is not going to be appropriate. Not every type of insurance is going to be appropriate for everybody, but these are some common ones. Once we've done all the data collection, the information gathering, now it's time to stop and look at our current situation. So if you've done the financial big picture document, you can answer number one pretty easily. But then it's about, well, do you have predictable income? Many times people are still looking for a job, or maybe are still doing part-time work or gig work. So their income isn't as predictable as maybe it once was, or maybe they're still in school. And so that really changes things, you know. But understanding where you are now is going to also be helpful when you're trying to figure out the goals. What is your goal? Or what are your goals? You may have more than one. So it might be that the thing that brought you here today is, I've got to pay down the debt. I have so much debt, I've got to deal with that. Maybe it's more about, okay, now I'm through the thick of it, I really want to focus on saving money. But even when you think about saving money, understanding the why behind that. So are you saving up for a big purchase, a wedding or a home or a car? Are you trying to just save what I call a JIC fund, a just in case fund? I don't like to call them emergency funds because sometimes you need money even when it's not an emergency, but it's money you're just setting aside just in case you need it. Maybe your ultimate goal is to plan for retirement. So understanding what the ultimate goal is going to be really critical when you go to the next step of creating the budget. Now, there are a lot of things I say on a daily basis that are easier said than done. Creating a budget is probably up there at the top. It's so easy to say, oh, just create a budget, stick to your budget. It is so hard to actually create a budget and stick to it in real life. Understanding the different steps can be helpful. It doesn't necessarily make it all that easier, but it can be helpful. And so I think the first step is think about you as a person. What are the types of systems that you operate in a daily basis? And how can you sort of extrapolate that and apply it to creating a budget? So are you the type of person where if it is right in front of you, you can stick to it? So if you have lists in front of you, then you know you're going to get all your things done. Then maybe a cash envelope system is going to be the best thing for you. So you get your paycheck, you cash out your paycheck, and you have envelopes that you have designated for each bucket of spending that you have. Maybe it's using software or an app, but really all you need is a pen and paper. At the end of the day, this can be very analog. Once you've picked your method, step 2 is going to be identifying the income. Hopefully this will be easy if you've done that financial big picture. But also here, think broader about sources of income. So are you receiving unemployment or disability insurance? Those are going to be income sources. Do you have any interest from a stock account or a bank account? Do you have other type of insurance that's maybe providing you a payment? All of these things are going to be income. Then comes the hard part, which is identifying the expenses. Over the years, I've come up with these 6 categories that I think most people have at least one item in each of these categories. So housing, whether that's your rent or your mortgage, what are the types of other utilities that go into that? So you need to pay for things like electricity and gas and internet. If you live in Chicago, maybe you're paying for snow removal, property taxes, those are all go under housing. And then there's living expenses, which is going to include things like entertainment and personal care, like haircuts or nails, getting your nails done. Transportation. Everyone has some expense when it comes to transportation, whether that's a car payment or gas or bus or, public transportation. Consumables. So that's going to be anything that you might need to purchase over and over and over again. So groceries, toilet paper, clothes are going to be consumables. Then we get to the 2 categories that really are going to be most different for people. So savings, depending on someone's situation, maybe they're only going to be putting a little bit into savings because their ultimate goal is around reducing debt. Maybe they don't have as much debt, or their debt is really low interest. So if your major debt is a mortgage at a 3% interest rate, perhaps putting more into savings for that JIC fund is going to make more sense. So this is really going to be very specific to each person. But the one thing that is going to be true for all of you is that in order to create a useful budget, you have to be realistic. I often find that people try to be the best versions of themselves when they create their budgets, and they might not include things that they think others might judge. And my favorite example of this is a woman who was in the middle of treatment for her breast cancer. And she said to me that getting her nails done every other week was the thing she looked forward to. She would sit in the infusion chair and she would think about the next cool design she was going to get on her nails. But it cost like $75 every 2 weeks. And here she was struggling financially. And so she was really kind of struggling with this whole idea that here she was spending this money that maybe she shouldn't be on her nails, her silly nails, in her words. But that was the thing, is like, that's a coping strategy. So that's not just getting your nails done. That's something really important for her in her place and where she is. And so then it was about, okay, well, what can you maybe cut back on so that those $75 nails aren't such a burden? And so she decided she didn't need all the streaming services that she had because that wasn't as important to her. So my point in telling that anecdote is really about, in order for this to be a useful tool and not just an exercise in futility, you have to be realistic with what your situation is and what's important to you, and make the budget around that. Now, of course, there are all these tools I mentioned. So there's probably a million different apps that you can download around finances and budgeting. These are a few that I have personally played with and see some really usefulness in. As you can see, they all have different price points. Some are free. Before you go down the rabbit hole of apps, I think that the key is to go back to the goals that you already established. So if your overarching goal is around budgeting, there's going to be certain apps better than others. If it's about paying down debt, perhaps you're going to pick a different app. So it's helpful to do this in sort of a sequential order so that you don't spend all this time setting up an app that doesn't truly match what your goal is. But even with all the apps and all the things that you can find online, it's still a lot to create a budget on your own. So I just wanted to mention there are ways to get help creating a budget. So there is consumer credit counseling agencies, there are financial planners. There's a huge misconception around financial planners and that someone has to have a ton of money to utilize a financial planner, when in reality, most financial planners actually want to help people who are trying to build up their wealth and their financial stability. Two resources I specifically wanted to mention was Fearless Finance, which is an on-demand virtual financial planning situation. They charge by the hour, but you can come in and just ask for a 15-minute consultation and only pay for 15 minutes. So if you have some money to put towards financial planning, that could be a great tool. There's also a nonprofit called Savvy Ladies. And their mission is to help women build financial stability. And they have some fantastic programs, and they, in certain circumstances, will even match women with a pro bono financial planner. So there are ways to get assistance, both paid and free. Now, when you're thinking about your overall financial health, understanding your credit score is critical. Credit is something that a lot of people talk about or hear about, but maybe don't 100% understand what it is. So there's two things, really. The first is your credit score, which is a 3-digit number. The higher the score indicates to lenders that you are more financially responsible, let's just say, for lack of a better word. Having a higher credit score can be really useful if you are trying to access loans, because basically the higher the credit score, the lower the interest rate you're going to have. Now, we are entitled to the other piece of our credit, which is our credit report. Our credit report is going to actually be a list of all open and closed lines of credit we have, and any debt that we have is going to be listed on that credit report. There are 3 major credit bureaus: Equifax, Experian, and TransUnion. By law, we're entitled to a free credit report from each of these bureaus per year. So that knowledge can be useful in that if you're just trying to monitor and make sure that nothing wonky is on your credit report, you can be strategic. You ask for your credit report from Equifax in January, and Experian in March, and TransUnion in July, and I've lost track of the months, but you get what I'm saying. You can take, you can get them throughout the year just to monitor for free. When you pull those credit reports, you're going to want to look for anything that you weren't aware of or that you don't remember. I've heard stories of people finding minimal lines of open credit that they didn't even know existed. The other piece of it is, how old is their damaging information? So if someone has had a debt solution, for example, they've negotiated to close a credit card for less than the total amount. It's a common debt solution that people use. That debt solution will impact your credit and will stay on your credit report for up to 7 years. Bankruptcy information stays on your credit report for up to 10 years. So what's useful about that knowledge is you might be able to make different decisions based on that timing. So let's say, for example, 6.5 years ago, you closed a credit card for less than you owed, and that's on your credit report. You are now interested in buying a car and you need a car loan. Well, because your credit is impacted by that debt solution, your interest rate is going to be very high. So you're going to end up spending more money in interest. Perhaps you're in a situation where you can wait 6 more months to get that car loan, and then that debt will roll off your credit report, or excuse me, that damaging information will roll off that credit report. Your credit score will improve and your interest rate will go down. Certainly, it's not always possible based on life and timing, but the point here is that most people don't have this knowledge, and if you don't have the knowledge, you can't make an informed decision. Now, certainly, if someone's had a challenging financial situation, it is not the end of the world. There are absolutely ways to rebuild your credit. These are some suggestions. So always paying the minimum due on time, every time. Having your balances be less than 30% of your overall limit. So if you have a total line of credit for $5,000, you don't want your balance to ever go over $1,500. That means that your credit score won't be impacted negatively. And then, of course, there's all sorts of other ways that generally you can rebuild your credit. But paying that minimum due on time, every time, for every bill is so important. And yet, it can be really easy to miss a due date here or there, particularly when you are in cancer treatment. Most people are not thinking about, oh, it's the 15th, I better jump up and pay my bills when they're in the middle of treatment. So some suggestions on this are to streamline and simplify. So setting up bill pay, creating spreadsheets or checklists of all your bills so that you can quickly go down and make sure you're not missing any. And if you're really in a situation where this is a challenge, consider perhaps appointing a financial power of attorney. Financial powers of attorney are an estate planning document where you name an agent to be able to make financial decisions for you on your behalf. They're just one of many different types of estate planning documents that can impact your finances. And if you're interested in learning more about estate planning, of course, we have tons of resources on our estate planning hub. Now, because of the timing of this webinar, I couldn't walk away without talking just a little bit about taxes. So, of course, we all have to pay generally federal and state income taxes. If someone has earned over a certain amount in the year, they're required to pay federal employment taxes. But even if you haven't made very much, but you do have some self-employment earnings, you may have to pay taxes. Or even if you've earned under that amount, that $12,950 amount, but you've gotten financial assistance to buy a plan in the marketplace, you may have to file your taxes even though you don't owe any money. But even if you aren't required to pay your taxes, it may be in your best interest to file anyways, because you may be eligible for certain tax credits, which was essentially money in your pocket. It may also be that you get money back from those unreimbursed medical expenses I mentioned. So if any of these things sound like they might fit your situation, I just want to remind you that this year's tax day is April 18th, and you do have to file or have your paper taxes stamped by that date. There are lots of ways to get help preparing taxes, so you can DIY it, pen and paper, there's software, certainly there's tax prep services, but there's also some opportunities to get free assistance. So there's a volunteer income tax assistance program called VITA, where if you go to this website and put in your zip code, it'll find someone near you to help prepare your taxes for free. Now, in my last just couple of minutes, I have to recognize that sometimes, even if you've done all the things right, there just isn't enough money to go around. And so how do we think about other sources of income? Something that has become increasingly popular over the last couple of years is crowdfunding. I think crowdfunding is a phenomenal way to engage friends and family in what you are going through. It's a great way for them to be helpful, but there are some ramifications to crowdfunding that we want people to think about before jumping in feet first. Certainly the disclosure piece. So if you are keeping any piece of your cancer diagnosis confidential, let's say from your workplace, or maybe you just aren't putting it online, remember that these crowdfunding campaigns generally are going to be Googleable. It could also be that any money that comes in from these crowdfunding campaigns could impact access to other programs. Like if you're receiving health insurance through Medicaid or disability insurance through SSI or housing assistance or student aid, those could all be impacted by an influx of money from a crowdfunding campaign. There are some workarounds like a special needs trust or an ABLE account. And if you're interested in those, we have them detailed in our quick guide to crowdfunding. We also have financial assistance options on cancerfinances.org. As I mentioned, you can go in, but you do have to think as creatively as possible. So, don't just think, oh, the thing that I need help with is medical bills. Think about all the different sources of financial assistance and can you shift money around? So our quick guide to finding financial help is a good checklist to make sure you are sort of going through all the different opportunities. And before I open it up to questions and turn it back over to Megan, I do just want to invite you all to join us for our free conferences. Both will be virtual this year on May 20th and October 14th. Where we do sort of a deeper dive into some of these topics. It's a day-long program. All you have to do is register on our website. And then finally, if I'm not able to get to your questions today, or if something comes up in the future, I invite you to reach out to us through our legal and financial navigation program. Through this program, you can fill out a pretty quick form on our website, and then you'll get an email to schedule a call with one of our expert staff, most of whom are attorneys. On that call, we will probably ask you a lot of questions, and then based on your answers to those questions, we'll be able to give you accurate information about any types of programs that you might have access to, any types of laws that you might be able to benefit from. The most common topics we talk to people about are around health insurance, employment, disability insurance, and estate planning. Really, the goal through this navigation program is to give you the information that you need to take next steps. and to be able to advocate for yourself. So I just wanted to throw that out there, that today is really not your only opportunity to get to ask questions, because I also know that sometimes it's hard to ask these questions in sort of a group environment. So thank you so much. I will turn it back over to Megan to see if there are any questions.
Yeah, thank you so much. And if you guys haven't checked out the Triage Cancer website, it's amazing, a wealth of information. And Monica and her team are just awesome at being a support in that way. So thank you for the information today for sure, and for everything you do every day. As Monica mentioned, we have some time for questions, so please use the Q&A box at the bottom of your screen, or however you're looking at our screens right now, and we'll get to as many as we can. We have a couple in there already. There was a question, you spoke at the beginning about the appeals process for insurance, and this question was specifically around, are you able to appeal medical costs? The example here was an MRI, if it's that your insurance is only covering a percentage of that. Like, is there still room to appeal that?
It depends, would be my answer to you. So if it is a situation where you've gone to an in-network provider and your policy, for example, says we cover 80% of the cost for an in-network provider, and then they cover that 80%, that's not going to be something generally that's going to be appealable. However, where we do see challenges come up is where someone has gone for a service to an in-network hospital and seen an in-network provider, and that provider sends them down the hall to get an MRI. Well, it turns out whatever imaging suite in that hallway is not in-network. And so now the insurance company is like, well, we only cover 50% for out-of-network. That is what we would call a surprise bill. And there is now a federal law called the No Surprises Act. And so there's a 1-800 number and a website where you can submit your bill if it was a surprise bill, and then they will decide whether or not the insurance company should cover it at an in-network rate or not. So super long-winded way of basically saying it really does depend what type of bill it is. But if your policy says we're going to cover 80% and they cover 80%, then that's not necessarily appealable.
Got it. Thank you. Someone in the chat had mentioned that when his wife was first diagnosed with MBC, they were told that they were not eligible for disability, and then later found out that they were. So what are some of your suggestions for making sure people are getting the most accurate information, that they're speaking to the right people so that they know everything that they're eligible for?
Well, I generally think it's the don't take no for an answer. So for example, if that person went to the Social Security Administration and was told, oh, you're not eligible, there's an appeals process for that. The Social Security Administration has a 5-step appeals process, in fact. If it's a private insurance company and that doesn't sound right, you've been paying the premiums on a policy and now they won't pay out, there's a Department of Insurance in every single state. And so sometimes it does take, again, that self-advocacy and asking a lot of questions. I will also say, if you're in that situation and you're not sure if that sounds right or not, that's exactly why we started this legal and financial navigation program, so that people can come to us, give us the information, and then we can then give them information back about whether or not that sounds right or where to go for more help.
That makes sense. There was another great question in the chat. If someone's already been diagnosed, what are some recommendations for purchasing life insurance? What are best practices around that for those who maybe have recently been diagnosed or in the past?
I will say it definitely gets harder to purchase life insurance and disability insurance after a diagnosis. It doesn't mean it's impossible. So a lot is going to depend on the specific diagnosis. Is somebody still in active treatment? So there are some insurance policies that say, once someone is 5 years out of active treatment, then they'll sell them a life insurance policy again at that point. There are different types of life insurance policies. Some are harder to get than others. So yes, definitely harder because we don't have the same protections around pre-existing conditions in life insurance and disability insurance that we have in health insurance, but it doesn't mean that it's impossible. And so the blanket answer there is going to be shopping around. And if it's not possible right now, is it something that you can try again next year or potentially the year after?
Someone asks a follow-up question, but I think you covered this on, does that change in any way for someone diagnosed with metastatic breast cancer?
It does.
Mhm.
It does. It is significantly harder to get life and disability insurance privately once someone's been diagnosed with metastatic cancer. However, if we're talking about the federal disability insurance programs, a metastatic diagnosis can actually make accessing those programs, I don't want to say easier because they're never easy, but metastatic diseases is one of the things that the Social Security Administration does look at. So again, it depends on the type of disability insurance we're talking about.
Right. And that's all I know laid out on the Triage Cancer website, the different disability programs. And
it is in a number of places.
In a number of places, yeah. Reminder to everyone, if you have a question, to use the Q&A box. I did see a couple of people use the hand raise option. We prefer that you use the Q&A box just so we can keep track of all of your wonderful questions and make sure that they get answered. Someone did ask about student loans. So the exact question was, assuming the student loan pause ends later this year, are there any other options for people living with MBC who still have student loans?
There is actually a forbearance or a deferment, I guess, for individuals with disabilities specific to cancer. And so on our website at triagecancer.org, if you go to the education module on cancer finances, there's more information. You can also reach out to us on navigation and we can give you the exact link to the application to fill that out for the cancer-related deferments.
Great, thank you. Switching gears a little bit, there's a question about financial resources for egg preservation and IVF. And this person specifically already took a loan out for part of the process and has paid it back, but will be starting IVF. So are there options, in addition to potentially for the IVF, but in recouping some of the loan that's already been paid off?
So unfortunately, fertility preservation is a really tricky one to talk about generally because it's going to depend on the type of health insurance and the state that somebody lives in. I will say that there are more and more states that are passing state laws to require insurance coverage for fertility preservation in situations when somebody has a cancer diagnosis. I will also say that if someone goes in for fertility preservation and their insurance denies it, usually it's because you don't yet have the diagnosis of infertility. That's usually the reason why it gets denied. That's an appealable situation. That's exactly where using that urgent appeals situation can be so useful, because what you're doing is showing the medical necessity. And we really encourage people in that situation to appeal those denials, because then it also shows that there is a trend in states where insurance companies are not covering that. If someone's already paid for it, then depending on the timing, it is something that you could submit to insurance. They might deny it. You can potentially appeal it. If you win the appeal, then you would recoup that money. But it would again sort of depend on the specifics of the situation. Now, in terms of paying for the IVF, which is different than the preservation, There are some financial assistance options. We have some listed on Cancer Finances. I know Resolve is a fantastic national organization that also has some financial assistance options. I believe Livestrong might still have some financial assistance options for family building and IVF, but a lot of that is detailed in our Cancer Finances module on family building.
Great, thank you. There are a couple of questions in the Q&A referencing grants. If the person who submitted that could just clarify what types of grants you might be referring to, we'll definitely try to get your question answered. There's another question about the considerations or implications for either deducting or liquidating a 401k or I'll say retirement fund more generally.
That is, and I swear I'm not purposely trying to dodge these questions. It's just they end up being so specific to people's situations that it's hard to give blanket answers. But that is one of those questions I would strongly recommend you ask a financial planner, because there could potentially be tax implications and penalties on early withdrawal that outweigh the benefit of early liquidation. And so it would really depend on someone's overarching financial big picture to decide whether or not those penalties might be worth it. It also depends on the type of retirement, if you're pulling it out early. So for that person, I would really strongly recommend, if you're a woman, to contact Savvy Ladies, because I know that they will do that for free, or potentially to find a financial planner in your area to be able to do that deep dive into your situation.
Yeah, and I think that's great advice overall. You're not dodging questions, but there's so many things that are so specific to each one of us. And Monica provided some great financial assistance and financial planning resources that certainly can answer some of those questions. So the questions about grants refer to, I guess, financial assistance after diagnosed with breast cancer. So if you have lack of funds, and the question is around, can those be taxed, and or can disability be taxed?
The answer is maybe and maybe.
Mm-hmm.
So it's going to depend on the type of grant and how it was provided. And if those grants push you in over taxable income requirements. So for example, if someone's not working at all and has absolutely no income and maybe gets a $500 grant, that's not going to be enough to make you have to file federal taxes. So the grants piece is a little tough, again, talk about generally. For disability insurance, I will speak about the two federal programs. So SSI, which is Supplemental Security Income, is never taxed. SSDI, which is Social Security Disability Insurance, can be taxed by the state, and depending on how much your income is. So it is possible that you would have to pay taxes on SSDI benefits. And then private policies is also going to depend on how it was paid for, to be honest.
We have a few minutes left. I'll probably close out with some, because we haven't touched too much on the credit and debt aspect of it, which I know you ended your presentation with. You mentioned that, there are certain things that stay on your credit score for certain amounts of time. How would somebody find out what that looks like, how long those periods of time are?
So the easiest way to think about it is bankruptcy, and most people know if they've gone through bankruptcy, is 10 years. Pretty much everything else is going to be 7 years where it's going to stay on, unless it's medical debt that has been paid. And that's a new rule that started, I believe, July of last year, where the 3 major credit bureaus decided that once medical debt gets paid, it's going to be wiped off a report. So that's really good news because it used to stay on for 7 years too and have such a long-term impact. So before someone goes into a situation where they utilize one of those debt solutions, like paying off a credit card, for less than a total amount, they really should understand what their next 7 years are going to look like. So if in 2 years you're going to be thinking about, trying to get a mortgage, maybe you need to wait to have that debt solution and try to come up with other solutions to pay down that debt, because that is going to impact your ability to get a decent interest rate for your mortgage. The same with bankruptcy. In most states, in fact, you have to go through credit counseling before you can even file for bankruptcy, because it is such a long-term decision.
Mm-hmm. Yeah, that makes sense. And I guess just one kind of closing question, obviously a lot of the people online watching right now and who'll watch this later have either already gone through a cancer diagnosis or they're a loved one of somebody who has. And unfortunately, we all go through medical issues through life or a family member has. What would be your number one tip to prepare for that? Like they've already gone through that a little bit, potentially dealing with medical debt insurances, but like, how can we prepare ourselves for down the road should another health issue come up for ourselves or for our loved ones?
Having the right health insurance policy is key.
Mm-hmm.
So making sure you understand the out-of-pocket maximum and the network of whatever policy you pick for next year is the number one most significant thing to protect your finances in the future. And unfortunately, what happens is a lot of people look at just that monthly premium and they might get sticker shock thinking, well, I can't pay that monthly. And they don't necessarily think about what the out-of-pocket maximum is. And so that's what that worksheet I showed helps us do, is it helps us figure out, in a worst case scenario, if I were going to need all the medical care there is in a year, what am I going to pay out of pocket? Doing that on the front end is going to help a lot of these challenges on the back end.
That is great advice. And we still have the link up on the screen for Triage Cancer. So we definitely encourage everyone to visit all of those wonderful resources. And thank you, Monica, so much for being here. I learned a lot. I hope everyone else did too. You'll be able to find this recording on the YSC YouTube channel. And as always, on our social media, you'll find out about future events and educational programming. So please stay tuned, and thank you to all of you for attending and for your wonderful questions. This was a really engaging conversation. So thank you to everyone.
Thank you so much.
Yeah, bye. Have a good weekend.